Torn rotator cuff. Torn supraspinatus tendon, diagnosis, treatment, and rehabilitation. A comprehensive overview of clinical and physiotherapy management by Megady, David, Alexis, Kiyoshi, and Christian. Ptap 1300, January 14th, 2025. Key muscles of the rotator cuff. The supraspinatus is the most affected in rotator cuff tears. It's responsible for initiating shoulder abduction. Infraspinatus is responsible for the external rotation of the shoulder. Teres minor is responsible for the external rotation and adduction of the shoulder. Subscapularis is internal rotation of the shoulder. These muscles stabilize the humeral head in the glenoid cavity, maintaining shoulder function. What causes the rotator cuff tear? Common causes: acute trauma, falls, heavy lifting, direct blows to the shoulder. Overuse, repetitive overhead motions, sports or manual labor. Aging, tendon degeneration with age. People over 40 are more at risk. Impingements, narrowing of the subacromial space leading to friction. Decreased blood flow. Blood flow in the rotator cuff decreases with age, making them prone to tears. Tear types.
Partial tear. The tendon is still somewhat attached to the arm bone. Full thickness tear. The tendon is completely torn. The tendon separates completely from the bone, affecting the shoulder's function.
How is the diagnosis confirmed? Diagnostic methods. Imaging. MRI is gold standard for visualizing tendon tears and other soft tissue damage. Ultrasound is non-invasive and can assess tendon movement and tears. X-ray helps rule out bony abnormalities like bone spurs or fractures. Non-surgical treatments. Conservative approaches. Rest. Avoid activities that strain the shoulder and use a sling. Physical therapy aimed at strengthening surrounding muscles, improving mobility, and reducing pain. Medications. Anti-inflammatory drugs to reduce pain and inflammation. Corticosteroid injections for pain relief and minimize swelling. Ice or heat therapy to ease pain and swelling. Surgical treatments. Indications for surgery. Full thickness tears or tears causing significant functional disability. Non-responsive to non-surgical treatments. Types of surgery. Arthroscopic repair, a minimally invasive procedure where the tendon is reattached. Open surgery, in cases of large or complex tears. Tendon debridement, removal of damaged tissue. Rotator cuff repair with graft. In cases of extensive damage, tendon grafts are used for reconstruction.
The most common repairs for rotator cuff injuries are arthroscopic repair, mini open repair, and traditional open repair. Arthroscopic repair is a minimally invasive procedure where the surgeon uses an arthroscope to repair the injury through the video feed they receive. This allows the surgeon to see any other structural damage that may have occurred. Mini open repair is a combination of traditional open repair and arthroscopic repair. After creating a small incision, the surgeon then uses an arthroscope to treat other damaged structures, such as the removal of bone spurs, before repairing the rotator cuff through the miniature opening. A traditional open repair was one of the earliest methods used to repair rotator cuff injuries. This method is used usually when the tear is large or complex and additional reconstruction is needed. This procedure requires the surgeon to split or detach part of the shoulder muscles to gain better access to the tendon. A newer method currently being used to help irreparable rotator cuff tears is the in-space balloon. This new and less invasive procedure uses a saline-filled balloon as a temporary spacer between the humeral head and the scapula where the rotator cuff tendon should be. This allows the humeral head to stay in place and centered so they can rehabilitate easier and retain the muscles that are still intact as a healthy, functional joint.
The ICF model. ICF overview. Medical diagnosis. Torn supraspinatus tendon. Physical therapist diagnosis. Pain in the shoulder, reduced range of motion, and pain. Body functions and structure. Impaired muscle strength, decreased range of motion in the shoulder joint, pain in the shoulder, especially with activity. Activity. Difficulty performing daily activities like lifting, reaching, dressing, and personal hygiene. Participation. Minimal or no participation at work. Reduced ability to drive a car to go places or socialize with friends. Environmental factors. Supportive or hindering factors. Example, work setting, rehabilitation facilities. Personal factors like age, general health, and exercise habits influencing recovery.
Recovery time after surgery. Wear a sling to immobilize the arm for 4 to 6 weeks. The patient can then start physical therapy. PT will last from 3 to 6 months depending on how quick the patient pre-injury condition. Full recovery may take up to 12 to 18 months. When to start physical therapy? Timing of PT. The formal physical therapy should not start until the surgeon has cleared the patient to remove the sling and initiate the AROM phase of rehab. Typically, this begins at 6 weeks. Post-surgery, 0 to 6 weeks. Begin with general range of motion exercises as prescribed by the surgeon. Early PT, 6 to 12 weeks. Focus on pain management, mobility exercises, and maintaining muscle mass in surrounding muscles. Late PT, 3 to 6 months. Strengthening, functional training, and restoring activity-specific movements.
PT treatments and exercises, 7 through 12 weeks. Goals: increase mobility, gentle shoulder movements to prevent stiffness. Strengthen surrounding muscles. Emphasize scapular stabilizers and rotator cuff muscles. Exercises: pendulum swings to gently move the shoulder. Passive range of motion. ROM exercises using a therapist's assistance or a stick. Isometric shoulder exercises for activation of rotator cuff muscles. PT treatments and exercises, 13 through 16 weeks. Goals: restore shoulder strength. Focus on building strength in the rotator cuff and scapular muscles. Improve endurance and flexibility. Gradual, load-bearing exercises. Exercises: TheraBand external rotations, strengthening the rotator cuff. Scapular push-ups, to strengthen the scapular muscles. Lateral raises, for shoulder abduction and rotator cuff activation. PT treatments and exercises, 17 through 22 weeks. Goals: functional training, reintroducing functional movements. Return to activity, gradually increase intensity for sports or work tasks. Exercises: rotator cuff resistance band exercises, full resistance exercises to rebuild strength. Shoulder press, for increasing shoulder strength and function. Sport-specific drills. For athletes, incorporate activities that mimic their sport movements.
Conclusion. Rotator cuff tears, particularly the supraspinatus tendon, can significantly impair shoulder function. A comprehensive approach involving a diagnosis, conservative or surgical treatment, and structured rehabilitation is essential for recovery. Timely physical therapy interventions improve outcomes and help individuals return to their daily activities and sports.